Welcome to our discussion on opioid withdrawal. If you or someone you know is struggling with opioid addiction, understanding the withdrawal process is an essential step toward recovery. Opioids are a class of drugs that include both illegal substances like heroin and prescription medications. These drugs are often prescribed to treat severe or chronic pain, but they also carry a high risk of dependence and addiction. Over time, the body becomes desensitized to these effects, requiring more of the drug to achieve the same relief. This is known as tolerance, and it's one of the key factors that leads to physical dependence on opioids. Opioid withdrawal occurs when someone who has become physically dependent on opioids reduces or stops taking the drug. The body, now accustomed to the presence of opioids, struggles to adjust, leading to a range of withdrawal symptoms. These symptoms are the body's way of reacting to the absence of the drug it has become dependent on. It's important to note that while withdrawal is incredibly uncomfortable, it is usually not life-threatening. However, it can be dangerous if not managed properly, especially if complications arise. Withdrawal symptoms can be divided into early and late phases. Early symptoms, which typically begin within the first 24 hours after the last dose, may include muscle aches, restlessness, anxiety, excessive sweating, insomnia, runny nose, frequent yawning. Later symptoms are more intense and can include diarrhea, abdominal cramping, nausea and vomiting, rapid heart rate, high blood pressure, dilated pupils and blurry vision. These symptoms, while painful, generally peak within 72 hours and start to subside after about a week. The timeline for withdrawal symptoms varies depending on the specific opioid used, the duration of use, and individual factors like overall health. Treatment options for opioid withdrawal. Managing opioid withdrawal can be difficult, but there are several treatment options available to help ease the process. Medications like methadone and buprenorphine are commonly used to manage withdrawal symptoms and can also be used as part of long-term maintenance therapy to prevent relapse. Clonidine can help reduce symptoms like anxiety, muscle aches, and sweating, making the withdrawal process more bearable. Over-the-counter medications may also be used to treat specific symptoms, such as anti-nausea drugs for vomiting or loperamide for diarrhea. Opioid withdrawal is a challenging but essential step on the road to recovery. With the right treatment, support, and care, it's possible to manage the symptoms and begin the journey toward a healthier life. If you or someone you know is struggling with opioid dependence, don't hesitate to reach out to Healthy Life Recovery for help.